we've all been sitting, so since I'm talking about lifestyle medicine and eyes, I thought we could all just take 30 seconds of my time and stand up and stretch. I like to stretch out your legs and give yourselves hugs, shoulders down to stretch out the upper back, other side. All right, you guys can keep stretching for 30 seconds. I'm gonna start my timer. That's a great idea. I don't wanna be here too long for you all. Okay, I assume you can all hear me okay. So lifestyle medicine and the eye connection. I think ophthalmology is a pioneering field in lifestyle medicine. Do I push the green button to go forward? Yeah, okay. Has anybody heard about lifestyle medicine? Yay! Anybody else certified in lifestyle medicine? No? Okay, great. So story time. Couple of stories. One, I became certified in lifestyle medicine in 2020. Am I echoing or should I stand back?
You're doing great.
All right, thank you. Because it all started with an episode of chest pain that I had at 36 and landed me in the ER while my family was on vacation at Disney World. And that led me to examine my diet choices and take a bunch of courses, and I'm going to get into my own story later. And then when Dr. Randolph asked me to do this talk, I started thinking about my patients and the topics we just talked about, of how some of them may live 5, 10, 15, 20 years of their lives blind. And these are pictures, you know, geographic atrophy, advanced glaucoma, and the rest of them may be healthy. Their heart might be healthy, they might be fit, but they're just not going to be seeing for the rest of their lives. Okay, we already talked about how many of you talk to your patients about lifestyle factors in their eye disease? That's amazing. Thank you so much. It should be everybody because we should at least be talking to them about smoking, but I'm going to talk about some other lifestyle factors. So my objectives for the talk, we're going to introduce lifestyle medicine, introduce longevity and the blue zones, which is also super amazing. How many have heard of the blue zones? Very cool. Introduce a concept called vision health span. I don't know if it's going to catch on, but something I came up with because of this talk. Vision span's already taken. I already looked that one up. Epigenetics on lifestyle on eye diseases, and then encourage you to talk to your patients about lifestyle medicine. So as I said, I am so impressed with the field of ophthalmology and how much published data we have about how lifestyle factors affect different eye diseases. All the way back to the 80s and the Blue Mountain studies and then the recent research. So what is lifestyle medicine? It is actually a separate field that started having board certifications in 2016, still ongoing. If you're certified in anything else, you can be certified in lifestyle medicine. And it's not just for physicians, you can do it as a nurse practitioner, a nurse, a dietitian, etc. There are different board exams for that. But it's focusing on what is known as Medicine 3.0. Has anybody heard these terms, Medicine 1.0, 2.0, and 3.0? Awesome. I did not come up with them. Medicine 1.0 is thought to be like what was in the 1950s, where we were just still figuring out what was causing diseases and figuring out bacteria and penicillin to treat pneumonia. Medicine 2.0 is what we're doing now in terms of treating diseases with medications, in terms of high blood pressure, diabetes, etc. And then Medicine 3.0, again, not a concept I came up with, is prevention, preventing all of these things from happening in the first place. Might be idealistic, but we gotta aim for that, right? So, and lifestyle medicine puts all of those in using the scientific method to try to come up with results and evidence-based recommendations for patients. So the 6 pillars of health, what I call common sense, but I love that we have structure from the American College of Lifestyle Medicine: nutrition, physical exercise, restorative sleep, stress management, and social connection, which I think is amazing that they made those 2 pillars of health, stress management and social connection, really, almost equal to nutrition, and then avoiding toxic substances. But why don't we talk about it more? Because there's not really any money in it, but I think it's really important. Okay, Dr. Campbell is somebody who changed my life. I've never met him, but when I was having those chest pain episodes and learning about diet, I took his Cornell course on nutrition and medicine, and that changed me. That's why I have this quote here that no man ever steps in the same river twice, for it is not the same river and he's not the same man, and changed my life. So hopefully learning about lifestyle medicine continuing after today will change yours. But in his newest book called The Whole Truth, he writes, the most important determinant of our health is nutrition. So I'm gonna focus on nutrition for this talk, just to inspire you. The blue zones, I think a lot of you had heard of it, so that's great. If you haven't, go ahead and go watch the Netflix documentary by the National Geographic journalist. It is the 5 zones in the world where people live greater than 100 years. But what's really cool, have you heard of the Blue Zones Project? Whoever's heard of Blue Zones? Yes? Awesome. So I think the Blue Zones Project is amazing. And there's actually a Blue Zone certification now through the American College of Lifestyle Medicine, which I just enrolled in. But basically, it's reverse engineering those Power 9 principles in the world, and they've already done it in 9 cities in the US, where they've implemented infrastructure changes in the entire community to decrease disease and decrease medical spending. And the fact that they're doing it is just amazing. But the Power 9 principles are similar to the pillars of health: move naturally, live a life of purpose, downshift, so decrease your stress. The 80% rule is to stop eating when you're 80% full. Plant or plant forward food intake. Wine at 5 for fun, I guess, but they did show that mild to moderate wine intake is good. And then connections, knowing who you belong with, your tribe, all of us, loved ones first, and all right. And then some more background for my talk. Let me see how slow I'm going. Okay, I'm doing okay. Lifespan. You guys know the concepts of lifespan, health span? Yes? Okay, great. So lifespan is how long you live, just to cover it. And health span is how long you're gonna live healthy. And then in doing this talk, again, inspired by the talk by Dr. Randolph, vision health span is something I came up with, is how long are you gonna live healthy and see well? And we want our patients to see as long as they live, right? It is a major quality of health issue and life issue that we just heard about for tractional retinal detachment. There's that picture of kale, because we're gonna talk a lot about kale. Have you guys heard about epigenetics? Yes? Okay, awesome. You're a very well-educated group. So there's the concept of nurture versus, so I did this talk, practiced on a few of physician colleagues, and nobody had heard of epigenetics. So anyway, thank you for being awesomely educated. But nature versus nurture, and this is actually how nurture affects nature, right? How our things that that affect us in our environment, how they affect how our genes are expressed and the phenotype that develops. So if we can change things that we put in our bodies or what we expose ourselves to, that will change how healthy we are as well. Okay, so looking at the 4 major diseases that can cause blindness: glaucoma, cataracts, diabetic retinopathy, and macular degeneration. And then looking at the table of all the 6 pillars of health, and doing a quick search, you can see that each pillar of health has definite influences on each one of the diseases. You probably already knew that, but the fact that there's this structure in evidence-based science is just amazing. I'm gonna focus on glaucoma and nutrition for the rest of this talk. Okay, and this is my little picture of prescribing fruits and vegetables and kale. We'll talk more about that. So there's 2 amazing review articles that I loved and looked at a lot of the references in, but this one was in 2025, and this, if you want to share a graphic with your patients, like pull this paper and download this graphic from the paper, but showing that eating vegetables, specifically kale and collard greens, increases the nitrates, which increase your endothelial function, improve your ocular perfusion, lower your optic eye pressure, as well as improve optic nerve head perfusion. It's just amazing. Exercise lowers intraocular pressure, but we need to be telling patients to do this and how specifically we're going to get more into that. Smoking. Do you guys counsel patients on stopping smoking every time you see them? Yay. You don't?
Not every time.
No.
I do. I'm like, are you still smoking? Okay, and then sleep disorders. We're probably talking about that too, but this was another paper that came out this year in March in the survey of ophthalmology that split all of the research done on these factors into level 1 and level 2 evidence. And you can read that it says that eating dietary nitrates, which is basically kale and collard greens, and retinols, all your healthy fruits and vegetables and berries, has level 1 evidence for telling our patients that we should be doing this. And then there's level 2 evidence things as well. And it's a really good paper that reviews a bunch of published articles, but I have a copy if you want to borrow mine. But let's look at some more studies that they talk about in those review articles. Okay, this was the Nurses' Health Study and Health Professionals Follow-Up Study looking at over 100,000 patients, men and women, and 25 years prospective data. And they split these patients up into their questionnaires of how many dietary green leafy vegetables they ate into quintiles. And compared to the lowest amount versus the highest amount, which was 1.5 servings per day, it was associated with 21% lower glaucoma risk, as well as 44% lower risk of early paracentral visual field loss, which is pretty amazing. So 1.5 servings a day is not that much. One serving is half a cup of cooked green leafy vegetables, or 1 cup of raw green vegetables, specifically in the study, kale and collard greens. Pretty amazing, right? I don't have any financial interest in kale yet. If there's a company I should buy, let me know. Another study, 2 studies actually, that was reviewed in the review article, talking about low-carb diets, because everyone's doing kind of low-carb diets. Doesn't matter where your carbs come from. And it showed that if you ate a plant-based low-carb diet versus an animal-based low-carb diet, there was a 22% lower risk of developing paracentral visual field loss. So the epigenetic influence of how our food is affecting visual field loss, published, not by me. I don't have any publications in any of this. This one is really, really cool. A study looking at older women, they showed that if you could eat carrots, 1 to 2 servings a week, kale or collard greens, 1 serving a month, or oranges and peaches were in a lot of studies, which was very interesting, that you could lower the prevalence of glaucoma by 64 to 79%. That's huge. I mean, here it showed that the overall prevalence of glaucoma was 8.2%, increasing with age. So if we're reducing by 79%, that means instead of 8 out of 100 women getting glaucoma, that's 1 out of 100 women getting glaucoma by the age of 80. So we need to be telling our patients to eat more kale and peaches and carrots. Okay. Then this other study showed that eating fresh fruit decreased your risk by 3 or more servings per day, decreased your risk of glaucoma by 79%, and then kale or collard greens, again, kale, hey kale, reduced your risk, even if you ate it just once a week, by 57%. Who wants to go buy some kale? Okay, awesome. All right, so this was another study showing that individual vitamins separately, just taking the supplements is not effective enough. Eating the whole foods is what matters. And they looked at different composite indexes. The top one showing synergistic effects of eating whole foods by 27 to 33% reduced risk. The bottom one showing reduced risk of diabetic retinopathy by 45%, cataracts by 63%, glaucoma by 52%, just by eating your whole foods, and macular degeneration. This is kind of a summary slide showing that maintaining a healthy BMI is associated with a decreased risk of glaucoma. BMI is not fully supported. Eating green leafy vegetables, hopefully I've convinced you that eating kale and collard greens is good for decreasing the risk and progression of glaucoma, or prevalence of glaucoma, sorry. And then doses that are high in calcium, potassium, and magnesium, especially in non-hypertensive patients, can be protected against glaucoma. Again, the foods that we want: kale, spinach, collard greens, sweet potatoes, avocado, and squash too. And then peaches, again, peaches comes up in a lot of studies, especially in women as we get older. Okay, let me see her. This one is just looking at what kind of food should we be telling them. I really love B vitamins too, and I'm really excited that the AREDS 3 vitamins that we have now have the B vitamins mixed in with the AREDS 2 vitamins. And these are just vitamins that are also good for decreasing risk of progression of glaucoma. Where do you find B3? In food. You find it in peanuts, peanut butter, avocado, brown rice, mushrooms, green peas. No kale on that one. And then vitamin C. I'm going to talk about vitamin C. There was a very interesting study. I have 10 minutes left. Okay, so we're going to talk about vitamin C a lot. Not a lot, but vitamin C is in bell peppers, oranges, cantaloupes, strawberries, kiwi. Specific foods, just briefly to touch on coffee. We know that coffee increases your eye pressure and is not as good for patients. So if you're checking eye pressure in a patient and they've had like 2 to 3 cups of coffee that morning, then you might want to have them come back and check the pressure again. Tea is actually thought to be protective because of the flavonoids. I threw chocolate in for the chocolate lovers. Dark chocolate does decrease your oxidative stress, and it does help, but more so in normal patients than in glaucoma patients, and it's thought to help a little bit in heart disease and peripheral artery disease as well. Okay, cataracts, we know that they are associated with lifestyle diseases such as diabetes, high blood pressure, obesity, chronic kidney disease, and autoimmune diseases. But did you know that elevated levels of carotenoids in your food can delay the onset of cataracts? And vitamin deficiencies, B3 and B2 deficiency, are linked to cataracts. So if you want to eat high carotenoid foods, kale, spinach, orange bell peppers, tomatoes, broccoli, and carrots. This was an interesting study about vitamin C and cataracts. To me, I always thought, like, if you have a vitrectomy and have retina surgery, you're going to get a cataract. You encourage patients. But this was a study showing that you can actually delay that progression of cataracts by supplementing these patients with vitamin C. Vitamin C levels are 20 to 70 times higher in the eye than in the blood, and removal of the vitreous decreases the oxygen gradient in vitamin C in the eye, which contributes to the cataract formation. And supplementation in post-vitrectomy eyes can decrease and delay that progression of cataracts, which is amazing. But of course, you don't want to let patients overdo it or high dose it. In the study, patients that had not had vitrectomy surgery did not have any benefit in terms of delaying their cataracts. But should we be does anybody tell patients post-vitrectomy to take vitamin C? Cool, right? Not my study again, but check it out. So smoking, this was a pivotal study that I'm sure everybody knows about that showed that smoking was related to uveitis, 143% higher risk, but I did not realize that it also was related to PSD cataracts over 10 years, 160% higher risk. So I'm just pointing out that cataracts are also related to smoking. It is also related to a higher risk of retinal vascular occlusions in smokers, 135%, and then glaucoma, as was my main topic, 57 to 147% higher risk of macular degeneration and diabetic retinopathy as well. So we should be asking our patients about smoking each visit. Okay, nutrition, I think we didn't talk about nutrition and diabetic retinopathy, but I'll kind of jump over this a little bit, since you know that these are very complicated issues with the social determinants of health, economics and such, but higher intakes of dietary soda, higher calories, do lead to higher risk of diabetic retinopathy, and higher sodium intake leads to higher risk of diabetic retinopathy. But it's been proven the fruits, vegetables, fiber, omega-3s are protective against diabetic retinopathy, and vitamin C a little bit of protective effect as well. There's one cool study, I can pull the citation for you if you need, that showed that if you meet 4 lifestyle criteria, including food, exercise, not smoking, and low alcohol consumption, you reduce your relative risk of diabetic retinopathy by 30%. Okay, just a little bit about lutein. Where do you find lutein? In kale and spinach, Swiss chard, mustard greens. Lutein has protective benefits against diabetic retinopathy as well. And again, it's in the AREDS vitamins. So should we be telling our diabetic retinopathy patients to be taking the AREDS 2 or AREDS 3 vitamins that have the lutein and the zeaxanthin and the B vitamins? Maybe, although we know whole foods are better, but if they're going to take a supplement, maybe that's a good one to mention to them. Lutein also helps delay progression of cataracts. Okay, so I feel that we owe it to our patients to have these discussions, and I urge you all to get certified in lifestyle medicine if you want to. This is not instead of course, medical or surgical therapy, but in addition to those. I know there's time limitations in talking to patients during your 5 to 15-minute visits, but maybe our goal could be talking to them about one lifestyle medicine pillar each visit, whether it's smoking or nutrition. And a little thought shift, maybe, are we losing the battle by the time patients are diagnosed with glaucoma or macular degeneration or diabetic retinopathy? And success, perhaps idealistic, would be when the incidence and prevalence of all of our eye diseases goes down. Can you imagine when we wouldn't have to treat such severe diseases? And I already mentioned the statistic that if we could go from 8 out of 100 patients to 1 out of 100 patients over time as we collectively get healthier, that would be amazing. I asked Open Evidence to translate this into a different way, and with 3% prevalence in 40-year-olds instead of 60 to 80-year-olds. And it showed baseline, 1 out of 39 patients would have glaucoma, but with green leafy vegetables, and using some of the studies, 18% reduction that we already talked about, it would be 1 in 48. If they ate kale or collard greens once a week, it would be 1 in 91, or once a month. On the other study, it was 1 in 127. So decreasing the prevalence would be amazing. Okay, how much time do I have? 3 minutes. Okay, so a couple of stories of impact. I had a patient who came in on Black Friday last year with a 6th nerve palsy. He's a diabetic, and he had double vision. He couldn't drive since Monday, and I was like, what are you doing? What'd you change? He's like, oh, I've been eating a lot of sweets because, it's Thanksgiving. And I said, okay, stop doing that and eat green leafy vegetables, half a cup. I gave him very specific instructions, half a cup every meal. And his 6th nerve palsy and double vision were resolved in 3 weeks. I did put a Fresnel prism on his glasses so he could drive after that. Had the same thing happen 2 years ago with another patient who came in immediately with a 6th nerve palsy. Gave him a diet of cutting out beef, cutting out pork, cutting out cheese, adding green leafy vegetables, half a cup per meal. 6th nerve palsy was gone in 3 weeks, and he had lost 30 pounds in 3 weeks. And I was like, this is amazing. Okay. All right, some more heroes of mine in the lifestyle medicine field. Dr. Esselson, Dr. Bernard, Dr. Ornish, Dr. Greger, but they're all amazing. Watch their videos on YouTube. Dr. Esselson's talk where he talks about these patients who have end-stage heart disease and complete stenosis of their arteries and changing their diets. At his study, he added 6 servings of green leafy vegetables per day, which is a lot, but was able to reverse their heart disease with a dietary change within 1 year, which brings me back to my chest pain episode. So if you want to learn more about me and my story, you can read about it in our book, of How Healers Heal. It's a compilation of 33 physician stories about how lifestyle medicine changed our lives, and then talking about mine because of my chest pain episode and learning about all of this. I changed my diet. I became vegan, gluten-free. I'm not vegan right now specifically, but because of that, my fertility skyrocketed, and I ended up with 2 surprise children in my 40s, which was a really, really cool side effect. Then my husband got a vasectomy. There we go. And that's it. Thank you so much. And then the QR code is a handout you could give to patients. And it talks about another concept in lifestyle medicine that I love: positive prescriptions and negative prescriptions. Positive of what to add, like the kale, and what to take away to stop smoking or drinking, etc. All right, thank you. Yes. Yeah.
Can you comment though on dirty dust and as it relates to kale and collards, so people are aware?
I cannot. Can you?